I'm Dr. Raj B Singh, the Chief Respiratory Physician at the Apollo Hospital, Chennai. Well, COPD stands for Chronic Obstructive Pulmonary Disease, and there's a variety of lung diseases or pulmonary diseases which are producing an airflow obstruction. And sometimes people lump all of them together and call it COPD. Well, that might have been the case several decades ago, but I think with the better understanding of the mechanism by which a particular group of COPD evolves, and we have recognized enough about these diseases to separate them into distinct diseases, and separating asthma from COPD. And COPD now is associated with chronic smoking or air pollution, which produces pretty permanent changes in the lung, producing airflow obstruction, which, unlike asthma, does not actually respond to medication all that well. And so if people continue to smoke or get exposed to polluted air, the lung function continues to deteriorate and eventually leads to respiratory failure. Now, over the years, COPD has unfortunately become more common in a number of countries, mainly due to the increasing prevalence of smoking, and in India due to increasing prevalence of air pollution, especially in urban environments. Now, COPD has actually become somewhat more prevalent over the years, and this could be due to a number of factors. One main factor could be the air pollution levels, and another could be the prevalence of smoking. Having said that, I think I should congratulate the governments over the years for preventing people from really increasing the use of cigarette smoking. And I think the publicity campaigns and other ways of discouraging people from smoking has in fact prevented a large increase in the prevalence of smoking. And that, in my opinion, has done far more to prevent COPD than many other measures. Having said that, with people who have already developed COPD, the management is quite a challenge, partly because the disease itself is such that it doesn't respond to treatment all that well, and secondly, the access to appropriate medication, especially inhalers, is not as easy in many parts of India due to a variety of reasons. And I think in that context, I would suggest that perhaps making inhalers available through government hospitals, either subsidized or free of cost, would go a long way in improving the lot of people with COPD, as well as those with asthma for that matter. I think what the government has already done should be continued to be done in the sense that preventing COPD is by far the most effective, cost-effective, as well as the most sensible way of preventing the disease and avoiding all the trauma and the expense of having to deal with the consequences later. But if people have already developed COPD, then I think the making sure that the medication is available to everyone, even those who cannot afford to buy it over the counter, that would still have to be provided by some kind of a healthcare provision by the government. And thirdly, I think we need to make sure that people are educated enough to understand something about the disease and its management, which means prevention and taking proper respiratory hygiene measures, and thirdly, making sure that the medication is used appropriately and regularly in order to have the maximum benefit from them. Preventing COPD is obviously preventing inhalation of toxic substances, especially cigarette smoke. And of course, nowadays we have the vaping and various other ingredients which are now promoted and being used by youngsters. I think this will definitely have to be curbed. Unfortunately, I think in many major cities, the air pollution levels are getting to be quite a concern, and that has to be addressed and put to rest. And I think these two measures will go a long way in preventing COPD from developing.